Joining us now, the Chairman of the Commons Health and Social Care Committee and, of course, former Health Secretary himself, Jeremy Hunt. Mr Hunt, lovely to have you on the programme. I wonder if we might just start by giving an overview of the committee's conclusions. I mean, it's been pretty clear for some time that there needed to be some reform of NHS litigation.
Thank you. Good morning, Neil. This might seem a rather sort of technical area, and it's very important to say from the outset that the vast majority of NHS care is absolutely excellent, totally safe. But when things do go wrong, we're very bad at learning from mistakes and making sure the same thing doesn't happen again in the future. And one of the reasons is the litigation system we have, which can mean that families have to wait 5, 6, 7 years before they actually get an answer as to whether they're going to get any compensation. It's absolutely devastating for them. And it costs the NHS over £2 billion every year to pay these claims. The biggest hospital in the NHS is Bart's Trust. That's more than the entire annual cost of paying for every single doctor and nurse in Bart's, that we're paying in compensation, in litigation costs, rather than on frontline care. And that's why we're saying there needs to be an urgent overhaul.
What then, in your mind, needs to be done? I mean, you're absolutely right to say that, lessons haven't been learnt in the past. You only need to look as far as the Ockenden report for that. So what needs to be done, and be done pretty quickly?
The first thing we say is that the priority needs to be to learn from mistakes. And to do that, we need to make it much easier for patients to get compensation. Ironically, if you make it easier for people to get compensation, you learn from mistakes, and it ends up costing you less because these things don't then happen again a few months or years later. And we looked at systems in New Zealand and in Sweden, which actually end up costing their health systems about half what it costs us here in the NHS. And that's because they just make it easier for people to access compensation. Here, you have to prove that a doctor or nurse has been clinically negligent before you get any compensation. And what that means is you have a very adversarial process right from the start. The medics feel very, very defensive. They don't want to talk openly because they're worried that there may be professional consequences for them. And right from the outset, you get a very negative atmosphere when actually what everyone wants to do is to be completely transparent about what happened, learn the mistakes, and make sure these terrible tragedies aren't repeated.
And this is the thing, isn't it? Ultimately, at the core of this, the NHS, held up by everyone, well, pretty much everyone in this country, as one of the things that we are so most proud of to be British. It also has to be mentioned that mistakes are made. Mistakes are compounded by cover-ups. I just wonder whether or not you think that the system is hindered or it benefits from the kind of the decentralised control of the health service by giving control to kind of the NHS Trust. Is there more or less of an attempt by individual hospitals to cover up their mistakes?
Well, it's a very good question. I'm generally in favour of giving more autonomy to hospitals and GP surgeries just to get on with the job. But I think in this case, the law gets in the way, and it makes it very difficult. If someone wants to, if you're a doctor or a nurse and something goes wrong, the first thing you want to do is to be honest with the families about what happened, to be completely open about it. But your lawyers are telling you, if you do that, you could be hauled in front of the General Medical Council, you could lose your licence to practice, you could cost us huge amounts of money. And there's one other thing that is really outrageous in the law and really against the founding principles of the NHS, which is that if the child of a banker is severely disabled because of a mistake, they will get more compensation than the child of a cleaner. Because extraordinarily, the way the law works is it looks at the likely future earnings of that child, and it decides that the child of the banker would have been likely to earn more in the future. That, to me, goes right against the founding principle of equality that underlines the way the NHS works, and we should change that as well.
I wonder, Mr Hunt, if we can kind of stay on your brief, such as it is, but get your kind of experience as a former health secretary. And of course, you know where I'm going with this. The High Court decision, the High Court judicial review yesterday of Matt Hancock's decision to move elderly people from hospitals into care homes. The Prime Minister said yesterday at PMQs that the government wasn't told of concerns about asymptomatic transmission by Public Health England, and that's nonsense, isn't it?
Well, I think the first thing to say is that to be Prime Minister or Health Secretary in a pandemic is an incredibly challenging thing. You're having to make decisions very quickly, and you are going to make some mistakes. And I think we have to be reasonable and think about the context that Matt Hancock and Boris Johnson were operating in. Our select committee looked at this report in detail, and we concluded, similarly to yesterday's judgment, that we should have done much more to learn from what happened in countries like Germany and Hong Kong, where when people were sent to care homes, for example, in Germany, they had to be isolated for 3 months unless there was a negative test. We didn't do that here. That was clearly a mistake. But I think the broader issue, and it's one that I have to bear my share of responsibility for as well as someone who was health secretary for 6 years, is that we just still have not sorted out the problems in the social care system. So when you have a crisis, it always ends up playing second fiddle to the NHS. The focus of, if I may say, Neil, also the media, but the politicians, the civil servants, the system is on hospitals and hospital care. And that's what everyone is thinking about. And what happened?
I would counter that we probably wouldn't have known as quickly as we did what was going on in our care homes if it wasn't for the media, including people like our People in Politics correspondent Nick Martin getting in there. I mean, the problem is, I suppose, Mr. Hunt, is we can't deal with this as an abstraction. You know, by June of 2020, there were perhaps as many as 30,000 excess deaths in care homes. And in part, that was as a result of a decision taken by the then Health Secretary, seemingly unaware of advice that if he'd switched on the Today programme, he'd have heard Sir Patrick Vallance giving.
Yes, I'm sorry. I wasn't saying that the media didn't have a very, very important role during the...
I was being somewhat cheeky. Mr. Hunt.
But I think the interesting thing is, actually, if you look at the High Court judgment, the advice the Health Secretary received from officials didn't advise him that he should think about this question of asymptomatic transmission. So there was a kind of groupthink in the system that said that this virus we were dealing with was going to be essentially like the flu virus, where you don't think so much about asymptomatic transmission. I think there are lots and lots of lessons to be learned, but the broader point I really wanted to make is that until we really fix the problems in the care system, then I think we're always going to find the centre of gravity in a crisis remains hospitals and the NHS. And that, in this case, had devastating consequences.
Mr. Hunt, away from health entirely, what do you make of the reports that one of your parliamentary colleagues, one of your Conservative Party colleagues, I should actually say, was seen by his colleagues watching pornography on his mobile phone in the House of Commons chamber?
Well, to be honest, I just feel so disappointed. Disappointed that it was someone in my party that was alleged to have done this, but also disappointed for the House of Commons as an institution. I have to say my day-to-day experience as an MP is not that this kind of thing is happening on a regular basis, but I just feel we should not be putting female MPs through this kind of ordeal. And it's totally and utterly unacceptable. And clearly we have to have a very big culture change. And, and I hope if there is some good that comes out of this, it will prompt that culture change that many people have been calling for.
Jeremy Hunt, always great to have you on the programme. Appreciate your time.
Thank you.